Good afternoon to everybody. I'm going to present about identification and management of eating disorders in children and adolescents. Abstract. The incidence and prevalence of eating disorders in children and adolescents has increased significantly in recent decades, making it essential for pediatricians to consider these disorders in appropriate clinical settings, to evaluate patients suspected of having these disorders and to manage patients in whom eating disorders are diagnosed. The range of treatment options, including pharmacotherapy, is described in this report. Medical complications in patients with eating disorders. Significant complications are seen in both outpatients and inpatients. Most of the medical complications of eating disorders resolve with referring and/or resolution or purging. However, there is increasing concern that some complications, particularly growth retardation, structural brain change, and low bone mineral density, may with time become irreversible. Malnutrition underlies many of the somatic symptoms seen initially, and these changes are often adaptive to the associated energy deficit. Treatment continuing for children and adolescents with eating disorders. Most adolescent patients with eating disorders will be treated in outpatient settings. Pediatricians play an important role in the management of these patients, assessing treatment progress, screening for and managing medical complications, and coordinating care with nutrition and mental health colleagues. Some pediatricians in primary care practice will feel comfortable in coordinating care, others will choose to refer some or all patients with eating disorders to those with special expertise. Depending on the ability of focal resources, these providers may be a specialty eating disorders program, an adolescent medicine specialist, a psychiatrist, or another mental health provider. Prognosis. The prognosis of eating disorders in adolescents have varied widely in the literature, and outcomes have depended on methodologic definitions of recovery and duration of following up in the studies reported. Adolescents' outcomes are significantly better than the outcomes reported in adults. Longitudinal reports reflect a more optimistic and less hopeless outcome. Following over time, the majority of patients fully recover, and an even large proportion have a behavioral cure, normal eating, normal weight, and resumption of menses. Conclusions. Eating disorders in children and adolescents are prevalent and have serious medical and psychological consequences. Children and adolescents have increasing potential for long-term complications, thus it is imperative that providers recognize the risk factors and screen for eating disorders in their patients. Early recognition and aggressive treatment is needed to prevent complications and chronicity. Treatment efforts that focus on weight restoration, reduce blame, and actively incorporating caregivers and families have emerged as particularly effective.
Well, the first thing to say about the topic of eating disorders in children is that eating disorders are actually a group of diagnoses that affect adolescents, children in general, quite frequently, so that actually the average onset of an eating disorder like anorexia nervosa, for example, is around the time of puberty or maybe 3-4 years after the onset of puberty, so in the mid-teens and the later teens. So when we talk about eating disorders in children, it's sort of like we're talking about eating disorders. But eating disorders, it does surprise some people to hear that they can affect children even younger than teens. So children at the age of 12, 10, even sometimes younger, we will see with presenting to eating disorders clinics with eating disorder problems and in need of help. There is some good news about eating disorders in children, which is that if you can recognize it early, there's a relatively good prognosis for recovery or the person sort of turning around the eating problem. And that is often particularly the case if the child and the family can work together with an experienced professional to help the child re-engage in proper feeding and eating behaviors. Children, of course, present special types of problems, especially younger children, in terms of trying to figure out whether an eating problem is going on. So a child is not going to be able to describe their emotional world in the same type of abstract way that an older adolescent or adult is going to be able to talk about their internal world. So there may be more sort of figuring out cues that you see in children, to figure out whether an eating problem is going on. So maybe a child's coming home from school and they're bringing back their lunch and it's not eaten on most days. Maybe that tells you something is going on. Weight loss, of course, if it seems to be progressing. And in particular with children, while there can be weight fluctuations, if you go to the pediatrician and the pediatrician says, oh, your child has fallen off the growth curve, that could be an indication, that something is going on. Clearly in children, you also always have to rule out, like with adults too, that there's not a medical problem that's contributing to the weight loss that better explains the eating problem. But the good news, again, is that with early intervention in these eating problems in children, there can be a relatively good prognosis. So again, like with all eating problems in children and adults, early intervention and treatment is critical.